Good morning, everyone, or afternoon, depending on where you're calling from. This is Greg Davidson from the RHSC. Thanks for joining us today. I think we're ready to get started. So at this point, I'll hand it off to Ellen Thompson, who will begin the webinar. Ellen, please go ahead.
Thanks, Greg. Good morning and good afternoon, everyone. My name's Ellen Thompson. I'm the chair of the System Strengthening Working Group. I would like to welcome everybody to the first webinar in our series that is focused on supply chain data for advocacy. And I'm really excited to introduce this series because this is a topic that has bounced around the coalition for a while. I can say, in fact, a number of years, and we've tried a number of different ways where we could sort of pair SSWG members with ANA working group members, and and they haven't really taken off, to be honest. And so here we are trying again, but we're trying this format of a webinar to explore this subject because we know how important it is to pair strong, reliable evidence-based with our advocacy work. So this webinar series is actually inspired by a workshop that was organized by the Advocacy Collaborative and was co-hosted by FP 2020 in Japigo in April here in Washington, D.C., which I attended. And for me personally, that was the first time I really began to understand how advocates and researchers or supply chain managers can work together productively to achieve common goals. And so, they say that imitation is the highest form of flattery. So here we are, bringing this topic here to our RHSC members. So what I hope is that, our discussion can build on what was started back in April and that we can continue the dialogue. And so to that end, our webinar series has a couple of objectives. The first is to expand on the idea of data is a dialogue. And this is the main theme of our series. You could see it in the emails that went out about it. So it's not just enough to provide some statistics or publish a paper and hope that your information will be used by advocates. You need a dialogue. And so here, in our second objective, we want to generate discussion on the topic of how to initiate productive conversations around data. It's not just enough to listen. There's lots of data being generated out there, and certainly, a number of initiatives, that I've seen through system strengthening in the past few years. We need to match this data to advocacy causes that we believe in. So right now we're planning a 3-part series, which we hope will be extended if successful. Today we will start by introducing our themes: advocacy as data as a dialogue. Subsequent webinars will drill down to regional and country level data. And I hope that you'll be able to join all of them so we can continue these discussions. Which brings us back to our theme, data as a dialogue. As we embark on this journey together, I challenge each of you to join this dialogue. Speak up, offer your thoughts, don't be silent. We're leaving plenty of time in each of these webinars to discuss the presentations, to ask questions, and to seek opportunities to work together. So today we start on that journey. As the first session in the series, this session will focus on introducing the purpose of the webinar series along with the topic itself. We'll have 2 short presentations, one from the advocate perspective and one from the data perspective. The data perspective will share information on common data sources available. It will then go into detail on PMA 2020 data. The advocacy perspective will focus on how advocates work with and use data along with a case example. As I said, there will be time for questions and discussion points at the end. So I invite you to enter your thoughts or questions into the question box. There's a chat box and a question box in the GoToWebinar format. And so be sure to enter your thoughts into the question box. And please feel free to do so at any point during the presentations. There's no need to wait until the end. We'll be going straight through the presentations, and then we'll read out the questions as they've come in. You can also, after the presentations, click on the button to raise your hand, and we can take you off mute so you can ask the question if you prefer or voice your thoughts if you prefer to do it that way. With that, I'd like to introduce our first speaker. Dr. YJ Choi is Associate Scientist and Deputy Director for PMA2020 at Johns Hopkins University. She oversees technical aspects of PMA2020 to ensure high-quality data, advance survey methods and research, and improve use of PMA2020 data by various stakeholders. Her current research interests include survey methods and data quality assessment in family planning and fertility transition in developing countries. Previously, she was a senior technical advisor for population and metrics at USAID. She has conducted impact evaluation research at Johns Hopkins University and program monitoring and evaluation at the World Bank. And she will be speaking from the data perspective. And with that, I'd like to turn it over to YJ.
Thank you very much, Ellen. Thank you for having me to share data side perspectives today. Let me make sure that I can advance my slide. Okay. Sorry for the technical glitches. I practiced 3 times, but it is not working. Greg, would you be able to advance the slide for me, or?
Sure, we'll take over control of the screen, and we'll just advance the slides from our computer.
Okay, thank you very much.
Sure. Thanks for your patience, everyone.
Okay, great, thank you. Let's go to the next slide. So these days, there are so much data for global health, both in terms of type and volume, and even for me, who's an avid data geek, it certainly feels like there's a sea of data. But I want to share that data producers want to collect high-quality data and generate information and knowledge that will be used for programmatically important decision-making, advocacy, and research. So we data users certainly do not want our data to be lost in the sea. Next, please. So before I share our experience, let me very briefly introduce PMA 2020. PMA 2020 is a rapid turnaround survey project to monitor family planning with support from the Bill and Melinda Gates Foundation. We are working in selected countries where the government made commitment to achieve the EPI 2020 goals during the first year of the initiative. So since 2013, PMA surveys have been conducted in 11 countries by our partners in each place, as shown in the box. We have disseminated 45 rounds of survey results so far, and more are coming soon. Next. So how does it work? Next slide. So for those who are new to PMA 2020, I want you to remember only one thing as a data user, which is that PMA collects data about both population and service delivery points shown in the 2 green circles in the diagram. Later in this presentation, you will see how the 2 different data can complement each other. And disseminating the results to stakeholders is an important component of our work. Next. So PMA data are available in various formats, including key results briefs, a snapshot of indicators, which is a set of detailed tables, and interactive indicator database visualization tool called Data Lab. But here's our question. Do these materials and tools meet data needs of advocates readily and exactly all the time? Often the answer is not yes. Next, please. So then I had rather impatient questions to my advocate colleague here at Hopkins. I asked her, how can we present data and information that is more useful for you? What data do you need? And even, why aren't you using our data more? And my colleague's very wise response was, YJ, data used for advocacy needs a dialogue. There is no one template and recipe to disseminate data, and we as a data producer are eager to be involved in this dialogue and facilitate use of our data. Let me share 2 specific examples. Next, please. In Lagos, Nigeria, Pathfinder International and PMA2020 Nigeria partner collaborated on a brief, which was about long-acting reversible contraceptive methods, shown on the left side. A piece of information in the brief raised a question from an audience: why do women cite cost as a barrier to use a method when all contraceptive methods are free in the Lagos state? And the question led to further data analysis by our partner, showed that one woman who obtained her method from a public facility paid certain fees. And then stakeholders in the state did more investigation, found even though a method itself is free, women were charged for consumables. So this conversation and investigation later resulted in a policy change. Now in Lagos, both methods and consumables are provided for free at public facilities. This is an example of dialogue and use of data that are not necessarily presented in a dissemination material, but sparked by more conversation. The next one is from Kitui County in Kenya. Next slide, please. When the county leadership was briefed about PMA survey results, they learned that stockout is minimal among facilities that offer IUDs, but a significant proportion of public facilities did not offer IUD, potentially limiting method choice. It was 31% nationally, but 43% in Kitui County. So the County Department of Health did further follow-up with facility managers in charge, and they identified lack of skills for IUD insertion and removal was a main reason for not offering the method. The County Department of Health then mobilized resources for IUD insertion and removal training. Next, please. So before concluding, let me share one example of data from PMA 2020 surveys that may be useful to start another conversation. Next, please. As many of you know, implant use has increased continuously across many settings. In this figure, the red symbol shows the percent of all women using implant by survey round across different countries. As you can see, the red dots are going up almost everywhere. Next, please. At the same time, the availability of implant at facilities remains high, or where the initial level was relatively low, the level has improved. So for example, in Uganda, please see the green bars there. The percentage of public facilities that have implants in stock currently and that have no history of recent stockout increased from about 40% to 60% over a few years time period. Next, but not all facilities that have method in stock are ready to provide the service. In Burkina Faso, for example, 80% of facilities have implant in stock. However, only 60% have the methods, associated supplies and equipment, and trained staff to insert and remove implants. Next, please. The final slide. So when we look at the quality of care among implant users, it appears to be fairly good. For example, over 90% women reported that they were told about the duration of protection. But 4 to 7% of current implant users said they tried to remove implant but couldn't. When we looked at reasons for this unsuccessful attempt, some imply that there are barriers at service delivery points. For those of you who are interested, you can go look at implant use and removal memos on our website. Next, finally, again, I want to emphasize and let you know that data producers want to facilitate data use and smooth sailing in the sea of data. Thank you, and we look forward to having a dialogue.
Thanks, YJ. That was a lot of data in a short amount of time, certainly. I think there's a lot to digest there, and then to think about and talk about. So with that, let's move on to our second speaker. Elisha Dunn Giorgio is the Vice President of Policy and Advocacy at PAI. Elisha oversees the programmatic work of PAI, ensuring that the organization's research and advocacy agendas are in alignment with PAI's mission and strategic plan. Elisha has more than 15 years of experience in the fields of sexual and reproductive health and international development. She holds a master's degree in epidemiology and a JD from the State University of New York at Buffalo. Elisha is also a returned Peace Corps volunteer, having served in Morocco. So over to you, Elisha.
Thanks, Ellen, and thanks for inviting me to participate in this conversation. It's one that I have quite often, and I really enjoy and think it's such an important thing to figure out how researchers and advocates can be better friends and colleagues. I just want to make sure everyone can see the screen, and I'm going to try, like YJ did, to move my slides forward. And it's not working either. So Greg, could you take that over?
Of course, one moment.
Great. Okay, so we can go to the first slide. And I think my job here is to maybe talk a little bit about how advocates think about data and our approach to using it and seeking it out as we talk about how to improve the dialogue between researchers and advocates. So I want to start maybe with just a little kind of character analysis. And so having listened to YJ, and I think having seen many researchers and talked to many researchers, we know that both researchers and advocates are incredibly passionate about the work that we do. And so I think that the passion is consistent. I think sort of the approach to work is slightly different, and that you heard from YJ in the beginning how researchers want to collect data, and it needs to be objective. And there's a lot of passion about the objectivity of data. I would say inherently advocates come to work in a different way and are probably less objective in their work. As a good advocate, your job is to persuade another person point of view. And so you're coming in with that frame that you may have already concluded something as an advocate, not based on empirical evidence, right? We heard the example that YJ gave of the Nigeria clinic. And so as an advocate, you might meet women who are asked to pay out of pocket and extremely expensive, and that really fuels your position that needs to change, but it's not based on a large swath of objective evidence, but rather on personal interaction, community experience. And I'm saying that because I think it kind of frames how we enter this discussion around data for advocacy and sort of bridging the communication gap that I see often happens between researchers and advocates. So just a little more, and I think some of this came through in the examples that YJ gave, but advocates are often seeking data that will help make a change that they think needs to happen. So again, it's advocates seeking data to prove a point. It's not necessarily advocates hearing data and then forming an advocacy plan. I think that a really good dialogue that needs to happen is that second one, and that there could be a lot more conversation between research and advocates where researchers identify data gaps or interesting points of data that help advocates to really make a strategic advocacy plan based on that data. I think the other thing for advocates is that when advocates seek out data, they're often seeking out data that is evidence-based and objective, but also the thing that will most likely sway the audience that they need to have make the change happen. So that adds another layer of maybe spin or persuasion on how an advocate looks for data. It's not always as objective because you're tossing in there the audience perspective. So what's going to move the policymaker? What's going to move the health systems administrator to make the change happen, so that women don't have to pay out of pocket? And I think that piece ties to this last point, which is that advocates aren't always interested in the methodology behind the data. And I think that can often be a point of tension between advocates and researchers, since researchers are so passionate about the methodology, and advocates will often go to what they see as a reputable source and recognized source without really considering how that data was collected or whether it's the best data. And I think this is a real opportunity for a dialogue around educating advocates and how to discern quality data. Next slide, please. So when advocates use data, I think the other thing is that data alone is not an advocacy strategy, right? That data is a tool for change, but it needs to be something part of something bigger, something comprehensive. And it's also really important as part of that comprehensive advocacy strategy that the data is simple and that it's context specific. And I think that this is a point of frustration, the context specific piece. I know for both researchers and advocates that we would love to have more data, more specific, especially as more countries, for instance, devolve. We need more subnational data. We need more data that's relevant to local communities. And I know that that's something that everyone is striving and looking for. I think the other thing for using data for advocacy is, again, that data in itself is not enough, and we really need to figure out a way for advocacy to interpret and synthesize that data in order to make change happen and to sway the policymaker, decision maker that can help facilitate that change. And this is a really key point, again, where dialogue and discussion should be happening more between researchers and advocates, because often advocates may interpret and synthesize data in a way that is not true to the methodology and the origin of that data source. And I think it's an important piece to really watch out for. For advocates as well, who are not necessarily like YJ or myself, honestly, data geeks, too much data can be really overwhelming, right? It can be kind of a turnoff for an advocate. And so trying to figure out how to filter all of the data that's out there, that sea of data that YJ refers to, can be really frustrating. And I think what happens then is that advocates go for, again, like the easiest source, the most reputable source, or the most recognized source, not necessarily the most recognized among, for instance, the reproductive health and rights community, but among the policymaker audience. So they may go for HMIS or DHS or UN data because that's there, it's easy to find, it's accessible, and it's too confusing to kind of dig through a bunch of sources. And then back to this last point of the comprehensive advocacy strategy, I think what we find with advocacy is that data is important. It may not be the lead on the advocacy strategy, and sometimes, depending on the audience, the human story is the lead. You need these kind of three pieces: the data, the human story, and the right messenger to really create that comprehensive advocacy strategy. Next slide. So now I'm just going to give a couple of different examples here of data and the way advocates have taken and synthesized data to use for advocacy strategies. So this first one should recognize from YJ's presentation. This is a data sheet from PMA 2020, and it was done in conjunction with some advocacy work that was going on and a kind of conversation that happened between PAI and Kenyan partners with PMA 2020 to speed up a brief that was already planned for subnational data so that it could be used for advocacy. And so there's some really great things about this from an advocacy perspective, and some things that advocates would still have to refine to really make it useful for an advocacy strategy. So a couple of the really great things are it's subnational. That is super important. The context specificity is great. The condensing of so many different data points into such a short brief is also great. The kind of color strategy that it pops, it's not word and narrative heavy, that's terrific. I think it is, from a research perspective, an amazing condensation of data, honestly. I mean, to get all of this into such a short brief is terrific. I think for advocates, there's still a piece here around the interpretation and synthesis and really understanding how to filter the important data pieces for the audience you're trying to reach. And I think that's where, again, this kind of dialogue really should be happening, because this information, you need to have it interpreted. And I think if you're an advocate looking for a specific data point for CALIFI, then you could go through this list and pull it out, but that might not give you the entire context of that data. And I think that's, again, where you could really speak with a researcher to better understand how this fits into the larger picture of health indicators. Next slide. So this is another example. This is a synthesis document produced by CRHE and MSI Zambia. And so this is an example of advocates taking a bunch of different data sources, synthesizing them and interpreting them into an advocacy publication. And it was timed, right? There's a couple of things about this that make it sort of more advocacy than research. So again, a bunch of different data sources. It was written for a specific advocacy purpose. It was released prior to national elections. So I think that's another piece that advocates often are under time constraints that data collection is not, right? And so talking with researchers about what's the best and most recent data that is objective and quality collected is another way for this dialogue to happen. And there's a couple of other things here that make this a little different than the other publication I just showed you from PMA 2020, that this one, it's about family planning. That's the advocacy objective, but as you can see from the slide, it includes information about education and about health systems. And again, that's really thinking about who is the audience for this and what is going to make this resonate with them. That family planning standing alone may not, but family planning data in the context of other development objectives may be really important and make this more acceptable and prominent in a policymaker's mind. The other thing is it is done by local civil society organizations. There were no kind of INGO stamps, no funder stamps, no branding on it. It was all locally produced, which was also really important. And it's also in the color of Zambia's national flag. So I think that that's subtle, but it's kind of an interesting advocacy trick. Next slide. And so this is another page from the same publication. And I think this is the other piece where you see interpretation and synthesis from the data, right? So there are recommendations that are evidence-based but the data ties into the recommendation. So that synthesis and interpretation is really important here because it leads to this next step of what can the decision maker do to make the change happen. And the other thing I just wanted to note here, I talked a little bit about this sort of use of data sources and where advocates might go for data. And if you can see, I know it's sort of small, but if you look at the references, they are again like pretty standard, well-known sources, UN sources, DHS sources, and maybe not the most innovative sources of data, but definitely things that resonate with the audience for this publication. Next slide, please. And so just as a closing slide, talking about some maybe lessons learned that we've seen over the years in this dialogue between advocates and researchers, I think, again, like there's so many sources of data out there, and really a lot of new and interesting ones that are probably better and more flexible, like PMA2020, and more routinely collected than a lot of the kind of standard bearers. But it's important to have a conversation with advocates about these new and innovative sources of data, and have advocates understand why they're useful, and also have advocates understand how to sell them to policymakers to help make policy changes. I think too that, again, YJ referred to this with that great slide of sort of the sea of data, and advocates don't necessarily know where to get data. If it's not accessible and transparent to advocates, it's just really hard to get it used. I mean, I think dissemination is probably the first step in getting the data used. And I don't, this is tough because I don't think the burden should be on researchers to package all the data for an advocacy audience, but I do think that that should be part of the discussion, is how should we present this to make it useful to you, or what is it that is the hindrance to you using the data? And I think YJ elicited to that in her presentation as well. And then just as a last point, I mean, I would say to advocates, go make friends with some researchers, and researchers go make friends with some advocates, and just have some conversations. There really needs to be more of this sort of ongoing dialogue, whether it's at the coalition table or one-on-one or within organizations, about how we enhance the use of data for advocacy. And that's it. I'll stop there.
Great, thank you very much, Elisha. That was, you know, as a, I guess I come from the data perspective, so it's, you know, fascinating to hear what goes on in the mind of an advocate. It sometimes seems like a very vague sort of, you know, approach to work. So that's the end of our presentations. As I said, we wanted to have plenty of time for discussion and dialogue and questions. And so I think I'm going to turn it over back to the coalition to help sort of collate our questions and read them out.
Thank you, Ellen. So far we don't have any question yet, so I'll repeat that you can write your questions in the question box, or you can raise your virtual hand. And because there's no other question, maybe I can start with mine. I had a question because I'm, as an advocate, I thought it was really interesting, Elijah, your presentation. But I was wondering, I always have the feeling that discussion is always about how advocates can make use of the data that data people have, but it's also very important for data analysts to understand how important it is that they work together with advocates. So I was wondering whether you could go a little bit more into detail on that part, more the other side. What's the added value for data analysts to work with advocates?
Sure, and I would ask YJ to chime in here too, because I know she works with advocates all the time. I mean, I think for me, from my perspective, one of the primary reasons is, of course, to have the data used for something, right? I mean, I think that that's the goal, as YJ said, for most researchers, that they want data to be used. I also think that data collectors, researchers could play a real role in helping to shape advocacy by, you know, I mean, the researchers understand all the data. They live in that sea of data. Then, so YJ had given an example of something maybe to spark a discussion around implants. I think there's a real opportunity there for data analysts to work with advocates to help, I don't know if it's like operationalize the data that they see or actualize the data that they see. But there's also a benefit to hearing from advocates about what works in the presentation of data. If your goal is to get the data used, then talking with advocates about what they see as beneficial presentation or information points while they're trying to make change, I think would help maybe data collectors and researchers to think about disseminating, how they disseminate their work. But YJ, do you have any thoughts about this?
Sure. I think for data people, it's really critical to work with advocates or any other stakeholders, data users, because, for example, in the 2 example slides that I showed you about Nigeria, Lagos, and Kitui County, those 2 points are not necessarily what I personally would have picked up and bring to my advocate colleagues that, see, did you see this data, and this is worth some discussion. They were completely, in a way, surprised to me, because number one, the cost is not typically raised very commonly as the barrier. And in Kenya, IoT use is not too high. So from demographers' perspectives, those are not the items that I would have paid much attention. But by working with our partners, that's where we understood that there's some very specific needs to understand those items, those topics more.
Thank you. In the meanwhile, we got a couple of questions. So we'll start with a question from Sarah Rich, who wants to thank you all for the webinar. As an advocate, I love the PMA 2020 data and have found it very useful when I'm working in a context where PMA 2020 data is available. There's no other data that compares. However, the reality is that many of us are working in contexts where this data is not available. I feel like whenever I'm engaged in conversations about data use for advocacy, the answer is PMA 2020, but this can be the answer where it's not available. We need to move this conversation beyond PMA 2020 or greatly broaden the geography of where PMA 2020 is conducted. YJ?
I appreciate the feedback very much. If the question is about expansion of PMA 2020 surveys to other countries or even within the countries to go deeper to oversample certain regions, we are in our transition year for our project. So expansion is currently definitely being discussed, but at the same time, we also work with limited amount of resources. So there's always this balancing between, do we go to a different country or do we go deeper to have a more local context specific data? So I don't have a good answer for that now, but I really appreciate your comment.
Thank you. And then we have another question also for you, YJ, from Megan Christofield. I'd love to hear more about how we engage with PMA 2020 and about making the data work for advocates, like if we have specific requests. Maybe share some examples on how other partners have done this.
Great question, thank you. So let me go back to the beginning of PMA 2020. When we started, the survey was designed to monitor specific set of indicators for FP 2020. And over time, we started working with specific technical working groups to collect data that's useful for the group. Examples are implants removal, the DMPA, subcutaneous injection, and emergency contraception technical working groups. So we studied adding some questions to measure specific questions that we discussed with these various working groups. So that's at the global level. At the country level, what we try to do in the next phase of PMA 2020 is to have a country-specific technical advisory group who can also review and recommend context-specific questions that can be added. But I also would say that as much as we want our data to be used, we also want to collect high-quality data. So whenever we add questions, there are different factors that we consider. So there's always that balancing consideration.
Thank you. Now we have a question from Sono Aibe. Budget decisions have devolved to county level in Kenya. How could advocates quickly find out who has what data for a specific county? How would you go about searching for it?
That's a great question. So Kenya is very data-rich country. PMA is one source there. So if you're interested in particular survey like PMA, DHS, and MIX, you can contact the organization, or often in our case as well, there's a list of county data that's included in PMA. The other one is the health information systems data in Kenya. It's relatively strong. It's publicly available. I am actually thinking there's no good simple list of looking at available data for each county in Kenya, even though it's very data rich. I'm not sure if anybody in the audience or Elijah, if you have any thoughts on that. Maybe that's
the only thing I was thinking was Track 20. I mean, I know that they've been doing some budget work and have recently been trying to strengthen the collection of budget information at the subnational level. I don't know how good the data is, but I think talking with Track 20 may give you at least some additional sources. But I agree with YJ, I don't think there is one, like if there was a comprehensive list, that actually would be great.
We have George Ogola in the audience who has been working with PMA 2020 data in the counties in Kenya. So I might just give him the floor and he can explain it.
Yes.
Hi, George.
Hi everyone. I love the fact that we have the conversation about the use of data and how we are using the PMA 2020 data plus other sources of data. I have experience working with the PMA 2020 data at up to the round 7 so far, and you realize that apart from the PMA 2020 data, we have the DHIS 2 in Kenya,
right.
which we have got a tool called the Family Planning Dashboard that has been linked to the DHIS. It summarizes the data about family planning in terms of service delivery, in terms of commodity stock, and in terms of the trainings that the healthcare providers have had. Apart from that, the DHS Kenya of 2014. So all these sources of data, how we're working together is once the PMA 2020 have done the dissemination, you realize that now all these people come together. Like the FP dashboard was originally by CHAI, the Clinical Health Access Initiative, supporting the national government to institutionalize it. So all come together, and when we want to come up with an advocacy product, in this case, for example, the Bungoma and Nairobi, I'm currently running a campaign in the next 1 week about commodity stock status in Nairobi County. So bringing all these people together in a co-creation workshop to just agree on what data to use, because I realized that the PMA2020 data, the latest, the round 6, is more or less the same with what is happening in the DHIS. So it is just a matter of bringing all these people together and the players together and agreeing on which data to use.
Thank you, George, for your input from the field. Very useful. And then we'll go to next question from Amanda Burgess. My question is, how do you feel can we build the capacity of advocates to understand and use data better at all stages of the advocacy process?
I can start that, and then YJ, you could chime in. I don't know if there's a one size fits all for that. It's a really great question. And I think it, I mean, not to go back to the topic of this webinar, but the discussion piece I think is really important. I think from our experience or personal experience at PAI, having researchers or program folks who really understand and use data for program work or are involved in data collection as part of coalitions or advocacy work has been really key and important. I think just that sort of having the conversation about when you're developing, for instance, materials to use in an advocacy strategy and campaign, having that voice at the table can really help build the capacity on both sides. I think there have been some definite attempts in like this one, really to have conversations in a more formal way, which is also really helpful. And I know around this sort of major conferences like Women Deliver or ICFP, there have also been a couple of times when there have been specific sessions and workshops looking at ways to bridge the conversation and build the dialogue between advocates and researchers. I think those are all really great. It's hard because people don't really have time for this amidst their work. So the better it can be mainstreamed as part of day-to-day activities. So whether it's coalitions or partnerships, I think that's one way to do it. YJ, any thoughts about this?
I would just second your thoughts that it's a capacity building on both sides. So it's data use for advocates, but also we data producers also need to learn how we disseminate and how we transfer and translate our data to different audience. So I think it's capacity building needed on both sides. And mainstreaming that would be awesome, great.
Thank you. Then we have a question from Monday Limbu. How do we support advocates to vet data and ensure they use data from credible sources?
I think it's a little bit along the lines of the question that was just asked. I don't think that researchers and data collectors need to necessarily police advocates on credible source use. But I do think it is worth both advocates maybe realizing that they may not totally understand the data and should ask some questions about it before using it, but also researchers reaching out to advocates if they see materials that misrepresent data or if they have sources that could be better. Again, it's a little bit of that kind of like the dialogue shouldn't happen one time, but it needs to be continuous. Again, though, I'd ask YJ if she has any thoughts.
No additional comments. I agree with you.
Well, thank you very much. We've come to the end of the questions. So, Ellen, I'm giving the floor back to you to close the webinar.
Thanks, Emily. And it's nice to hear that, you know, our topic of data as a dialogue with advocates is the right path to go in terms of building capacity, both on the data side and on the advocate side to better utilize available data. Although I think, as some of our questions have pointed out, you know, and especially getting down to, you know, specific subnational levels, there isn't it's hard to find the right data that we need to use. So, you know, today we went through with PMA 2020, learned about how they collect data, and then also heard examples from Nigeria, Kenya, as well as on implant use. And then from Elisha, we heard about, you know, this shared passion that we all have to improve women's lives through family planning. And then, you know, we talked about what the dialogue entails, how do advocates think. It's you know, fascinating to hear, you know, what kind of data is helpful, how not to be, you know, how we don't want to be overwhelming, and how it needs to be combined with a human story and a messenger. And then to think about the audience. And as we said, you know, data is a dialogue, and we encourage, you know, if we want to build capacity and mainstream this utilization, then we all need to, you know, go back to our organizations and start that dialogue ourselves. And so I challenge each of you to think about that and go back to your organizations and see what you can do. And so with that, we'll come to a close. Look to your emails for the information for our next webinar, which we hope will be on the topic of East Africa specifically. So thank you all again, and enjoy the rest of your day.
Thank you very much.
Thank you.